we are going to first talk about what a bow tie question is, and then we're going to end up practicing one together at the end. In this beginning part, I want to kind of just go through what they are, some tips and tricks to help you be successful with them as you approach these questions, and then we'll dive in. So the first thing to know before we get started on the bow tie question is I want to show you this important information about these next-gen style questions. Like bow tie questions are one of those next-gen style questions. So clinical judgment is really important, and the new next-gen NCLEX that we've been working on for the last couple years measures clinical judgment, and it's broken down into these 6 steps that you see here. It's broken into these, and we have recognizing cues, analyzing cues, prioritizing hypotheses, taking action, and evaluating outcomes. And I know this might not make a whole lot of sense, but we're going to use these steps as we break down our NCLEX question, our bow tie question. So let's first talk about the parts of a bow tie. So you're going to have your instructions that are given. These are standard, and then you're going to have scenarios and data tabs. So this could be anything. This could be a nurse's note. It could be lab orders. It could be multiple things. It could be diagnostic results, anything like that. So you're going to have these data tabs to read through and your scenario. And then you're going to have headers here that you'll see, which is going to be our actions to take. In the center, we have our potential conditions, and then our parameters to monitor. This is what you're going to pick from. In the center column, you're going to first pick your potential condition, and you have 4 options, and you'll drag that up to your center bow tie here. And then you're going to pick 2 actions and 2 parameters to monitor. And you'll drag them up into the answer spaces, and it looks like a bow tie. So that's how it has its name. So a big question we get is, will I have a bow tie on my NCLEX? And how are bow tie questions scored? So great question. With these, they appear on the NCLEX after completing 85 questions, and you could also see them as pre-test items. So how are these scored? The good news about bow tie questions is that you're going to earn 1 point for each correct response. So you can get up to 5 points. So obviously 0 points for any incorrect box, but 1 point for each correct answer. All right, so let's talk about some strategies to help make this a little simpler, because it is really overwhelming, I think, when you look at these bow tie questions and you have all these different options and different data tabs and things to take in and to consider. So as you approach these questions, I want you to first read the scenario and then review any data tabs. As you do that, you need to ask yourself if each of the findings that they're giving you is normal, expected, or is it abnormal, concerning. After you do that, you're going to consider each column separately. So you're going to first go to those potential conditions, and I want you just to think of this as a simple multiple choice question. Ignore the actions and the parameters in the other columns. So think about, what is this client most likely dealing with? What condition does she most likely have based on the information I'm given? And then consider these other ones as a select N, these other 2 columns, because you're only selecting 2. So you know that there's only 2 correct answers there, and you're going to select what fits best to deal or handle these actions to take for the condition and parameters that we want to monitor for that condition.